Trauma can deeply impact lives. It leaves invisible wounds that affect mental and emotional well-being. Understanding these wounds is the first step towards healing. This video explores 3 trauma-related disorders: PTSD, ASD, and adjustment disorder. Understanding these disorders fosters empathy and support. Seeking help is a sign of strength, not weakness. However, experiencing trauma doesn't automatically mean one will develop a disorder. Post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, is a serious mental health condition that can develop after experiencing or witnessing a terrifying event. Symptoms can include intrusive memories, nightmares, and flashbacks. Individuals with PTSD might also experience emotional numbness, difficulty concentrating, and irritability. Another common symptom is avoidance. People with PTSD may try to avoid places, people, or situations that remind them of the trauma. They might also avoid talking about the event altogether. Physical symptoms can also accompany PTSD. These might include increased heart rate, sweating, and difficulty sleeping. The constant state of hyperarousal can be exhausting and take a toll on physical health. The symptoms of PTSD can be incredibly distressing and disruptive to daily life. However, it's important to remember that PTSD symptoms can vary greatly from person to person. Treatment for PTSD often involves a combination of therapy and medication. Trauma-focused therapies, such as cognitive behavioral therapy and eye movement, desensitization, and reprocessing, are particularly effective. Acute stress disorder. Acute stress disorder shares many similarities with PTSD, but occurs within a shorter time frame. Symptoms typically emerge within 3 days to 4 weeks following a traumatic event. These symptoms can be intense and overwhelming, mirroring those of PTSD. They include intrusive thoughts, flashbacks, nightmares, and avoidance behaviors. Dissociative symptoms are also common in ASD. These can involve feeling detached from oneself, experiencing the world as unreal, or having difficulty remembering aspects of the trauma. One key difference between ASD and PTSD is the duration of symptoms. If symptoms persist beyond 4 weeks, a diagnosis of PTSD might be considered. However, it's important to note that not everyone with ASD develops PTSD. Early intervention can significantly reduce the risk of progression to PTSD. Adjustment disorder. Adjustment disorder differs from PTSD and ASD in that it is triggered by stressful life events rather than traumatic experiences. These events can include relationship problems, job loss, or financial difficulties. While these stressors are a normal part of life, individuals with adjustment disorder experience a disproportionate level of distress. Symptoms of adjustment disorder can vary widely. They might include sadness, anxiety, irritability, and difficulty concentrating. Behavioral changes, such as withdrawing from social activities or neglecting responsibilities, can also occur. These symptoms can significantly impact daily functioning. The severity of adjustment disorder can range from mild to severe. The diagnosis depends on the intensity and duration of symptoms. Effective treatments are available for trauma-related disorders. Trauma-focused therapies like CBT and EMDR help process trauma and develop coping mechanisms. Medication can manage symptoms, with antidepressants reducing anxiety and depression. Healthy coping strategies are essential for managing trauma. Mindfulness techniques like meditation help regulate emotions and reduce stress. Building a strong support system is crucial for recovery. Like and follow for more educational videos. And for opportunities to earn continuing education credits or CEU, please visit www.advancedpractice.io. Follow us on Instagram at advancedpractice